Rotator cuff tears are one of the most common shoulder conditions that I see in clinic, and one of the most commonly misunderstood. So in this video, I want to answer the question that I get asked most often: do I actually need surgery? I'm Dr. Matthew Boyle, an orthopaedic surgeon in Auckland. I specialise in shoulder surgery and arthroscopic rotator cuff repair. What is the rotator cuff? The rotator cuff is a group of 4 muscles and their tendons that wrap around the shoulder joint, connecting the upper arm to the shoulder blade. Together they stabilize the shoulder and power the movements you use every day, reaching overhead, lifting, rotating your arm. The most commonly torn tendon is the supraspinatus, which runs along the top of the shoulder. How do tears happen? Well, there are 2 tear types. Acute tears happen suddenly, typically from a fall onto an outstretched arm, a direct blow to the shoulder, or catching yourself unexpectedly on a railing. These are common in younger patients and active people, and often covered by ACC in New Zealand. Degenerative tears develop gradually over time. They're common from the age of 50 onwards, and they may be present for months or years before you notice them. A minor incident or increased activity is sometimes what finally brings symptoms to the surface. What are the symptoms? The classic picture is shoulder pain at the side or front of the joint, often radiating into the upper arm. Night pain that disturbs sleep is particularly characteristic of rotator cuff pathology. Weakness when lifting the arm or reaching overhead. Difficulty with everyday tasks like dressing or lifting. Diagnosis. Diagnosis starts with a clinical examination. Imaging confirms it. Ultrasound is widely available and accurate, and your GP or physiotherapist can arrange this. For larger tears or when surgery is being planned, an MRI gives more detail about the size of the tear and the condition of the surrounding muscle. When is surgery the right choice? This is the key question. Surgery is generally the right choice when the tear is large or complete, when symptoms haven't improved after a genuine trial of physiotherapy and injection, typically 3 to 6 months, when weakness is significantly affecting your daily life or work, or when the tear is acute and occurred in a previously healthy tendon. Acute, full-thickness tears in younger patients particularly benefit from early repair before the tendon retracts. Surgery is less likely to help when the tear is small and symptoms are improving, when the patient is older with acceptable function, or when the muscle behind the tendon has already significantly wasted away. Not every tear needs an operation, and not every painful shoulder has a significant tear. The imaging report is one piece of the puzzle. The clinical picture is what guides the decision. What does surgery involve? Rotator cuff repair is typically performed arthroscopically through small keyhole portals under general anesthetic, usually as a day or overnight procedure. Small suture anchors are used to reattach the tendon to the bone. The procedure takes 60 to 90 minutes. Recovery is gradual. The arm is protected in a sling for 6 weeks, then progressive rehabilitation over the following months. Full recovery, including strength restoration, typically takes 9 to 12 months for larger repairs. Getting assessed. If you have shoulder pain or weakness and you're wondering whether you need to be seen, start with your GP or physiotherapist. They can arrange an ultrasound and provide a referral. More information is available at matthewboyle.co.nz. Link in the description.